Have you ever heard of the birth defect called clubfoot? My youngest daughter, Jenica, was diagnosed with clubfoot at her 20-week ultrasound. We had never heard of it until then either. Clubfoot can be treated. I will be talking to you about the treatments for clubfoot from experience and medical research. There are many causes for clubfoot. It can be genetic, environmental, and something that just happens. Clubfoot can affect both feet or just one foot. Jenica has clubfoot of the left side. It affects her everyday life from walking, balance, and being able to keep up with other kids and her sister. Our experience with treatment has been a long 2.5-year journey. I was induced at 39 weeks to have Jenica so that her bones were underdeveloped. It makes it easier to start the treatment for the clubfoot if their bones are undeveloped. It is recommended to start treatment within a week of birth. They start with what they call a series of castings. They flex the leg as far as it will extend and put a long cast on it to hold the leg in place. Casts are changed at weekly intervals, and most deformities are corrected in 2 months to 3 months. Before applying the last cast, which is to be worn for 3 weeks, the Achilles tendon is often cut in an office procedure to complete the correction of the foot. By the time the cast is removed, the tendon has regenerated to a proper length. After the last cast is removed, the foot should appear overcorrected. This is just the beginning. The next step recommended is bracing. There are several different braces that can be prescribed. Jenica has done what is called the Ponseti method. All braces consist of a bar that is the length of the child's shoulder width with shoes or such on each end. We started with a straight bar with one foot positioned at 90 degrees. Basically, it's like having your foot pointed straight, and the other foot was pointed at a 35-degree angle, which is the foot pointing outwards, so that it doesn't turn in again. She had to wear these as recommended for about 4 months at 23 hours a day. We were only allowed to take off her braces for bath and dressing if needed. Then after that, you can go to 12 hours at night so the child can learn to function as normal as possible during the day. It is not recommended until a little older, but you can use a pivoting bar which allows the child to move their legs separately. This is Jenica's. So she can... We have the pivoting bar. Jenica didn't like the straight bar, so it was easier to do this pivoting bar. Jenica has tried different bracings like AFOs. They were recommended by her therapist, but denied by her doctor. We did wrappings. Where we would wrap her leg from her midsection down to her toes. She choked on the clips one day, so we stopped that treatment. Every doctor and therapist are going to have different opinions on what to use. We have had a lot of trial and errors. Jenica is only 2.5, so we still have a long road ahead of us. They say the next step, if the non-surgical bracing does not work, is surgery. No one wants surgery. Though there is some variation on surgery techniques, all of the major reconstructive clubfoot surgeries involve extensive soft tissue release of the posterior, medial, and lateral structures of the foot. The correction, once achieved, is usually held temporarily, about 6 weeks, with wire fixations across the joints of the foot. More surgery is required to move the wire. The need for additional surgery after the first operation is reported to range from 5% to 50%. Surgery is a last step due to the complications that can occur. Clubfoot is a deformality. Jenica's left foot and leg are a lot smaller and shorter than her right. Her left foot curves in at the arch point. From her having clubfoot and only one side, it affects her right foot and leg due to them having to overcompensate for the left. Our journey has just begun. Even though there is a treatment, my child will always be different from her peers and sister, and may have limitations. So if I could say one thing, is don't judge her for something she had no control over. The next time you see a parent with a child in a cast or braces, remember it could be a treatment for something like clubfoot.